Welcome everyone to today's PermanenteDocs Chat. I am your host, as always, Alex McDonald. And today we are talking about health education, patient education, and how we can help frame health education as an actual intervention as opposed to an afterthought. We are joined by my good friend and colleague, Dr. Ray Nanda, who is the director of the Kaiser Permanente Center for Health Education here in Southern California. So Dr. Nanda, welcome and thanks for joining us. Tell us who you are and what you do for those two people out there who don't know who you are.
I am the physician lead for something we call the Center for Healthy Living. You have some sort of analog, most likely, if you're in Permanente. If you're not in Permanente, we have a recruiting website, and we would love to have you. Come on in. And so what is that? That Center for Healthy Living is the evolution of health education, Dr. McDonald, as you know very, very well. And you've got the gamut of patients out there in the San Bernardino County area, right? From like super wealthy living on the hill to people just struggling to figure out how am I going to make rent this week. And health really is something that impacts everybody in a very personal way, in a very meaningful way in terms of their happiness. So we start with evidence-based. We look at that. And then what we'll do is we'll shift into something called human-centered design, which is not the old way of we will build it and you will come, but it is you are the target person we want to help. Let's build it with you. Tell us how we should build this so that we put up an evidence-based construct in a way that you would take advantage of, because we really want to be your partner in health, right? So in a nutshell, that's really what Center for Healthy Living is modeling, with those two facets. And there is an analog of that, I think, throughout the Permanentes. And I'm super proud of the work everybody's doing in health education / health Center for Healthy Living.
Absolutely. No, that's great. And yeah, we'll get into lots of the details here, but I want to even take a step back at this point. And, when people think of medicine, healthcare, they think of pills and procedures and diagnoses and treatments, but we know like 80 to 90% of what actually shapes a person's health happens outside of the four walls of an office visit or a hospital visit. And how do you think about the relationship between medical care and personal behavior, and how do you define the physician's role within that context?
That is an excellent question. There is no answer to this on the outside, and I wish that there was. But we have invested lots and lots of resources into how we help our patients live healthier lives. Dr. McDonald knows how to prescribe metformin. Dr. McDonald knows who needs an MRI, who needs this. But what Dr. McDonald may not be an expert is that person going back to work their second job? Is that person taking two buses to get to him? And that kind of thing that will impact what the patients are able to do with our counsel. So the way I frame it to my docs is you're an expert in what you're an expert in, right? And the patient is an expert in themselves. And when you partner, the opportunity is incredible to move patients forward in terms of their health and move health outcomes and provide this value-based care that we're the best at. And there's also a dysynchrony when sometimes we just assume things about our patients that they are capable of doing, and then we backtrack because we find out along the way that sometimes it's not so easy to do the things that we're asking them to do. Right, Dr. McDonald?
Absolutely. I can think of a patient. I saw a patient last week, actually, a middle-aged gentleman struggling with obesity and diabetes. And this man was prescribed probably 15 different medications for diabetes, and people just kept throwing more and more medications at him. And when I met with him and I sat down, he couldn't afford his medications. He wasn't taking half the medications. And so being a family doctor, I had a relationship with this gentleman. I knew him better. And rather than just doing some of these like patchwork pieces of throwing medicines here and throwing medicines there, we could actually sit down. And you want to talk about the root cause of a disease or root cause of a problem. When you can't afford your medications, that makes it hard when people just keep throwing medications at you. So I think that's what we do so well as family doctors, and just partnering with our patients when it comes to behavior change and understanding all the different things beyond all the things in our toolbox besides just medications. So again, when we're talking about behavior change and partnering with our patients, why is behavior change so difficult, and what is that? How can we help patients? How can we guide patients through making kind of real and lasting changes to their health and their diet and their physical activity, which we know are true underutilized drivers of health.
Yeah, so just to tie together the last conversation into this conversation, the last
Please.
conversation is that we have an enormous system around our physicians. We have an organic practice. So when you do your doctoring and you know that a patient needs help with medical financial assistance, they need
Yep.
help with where do I find affordable, healthy foods, they need transportation assistance. Center for Healthy Living is one of the constructs that helps
Yep.
support the patients getting their best ability to activate these resources that Kaiser Permanente in aggregate supports our members with. And that's how we're so different than every other organization. We really are, and we're blessed to be that way. But you asked me a very loaded question
I did.
about why behavior change is so hard, didn't you, Dr. McDonald?
I was hoping you wouldn't notice, but
So any good guest is going to turn it right back around to the host. So let me ask you a question, Dr. McDonald, and let
uh-oh.
me ask you, Podcast Land. Think about your New Year's resolutions for 2026, everybody. Okay. I'm not asking you to share because I know that they may be extraordinarily personal. Um, so, Dr. McDonald, in all honesty, it's end of May on this podcast. Have you accomplished all of your New Year's resolutions that you set out for 2026?
No, I'm going to go with no.
Okay, okay. Um, are you stupid? Are you non-compliant? Are you patient refuses treatment? Do those things apply to you?
Well, I should ask my doctor actually, maybe. I'm not sure. I like
No.
to think not, but it's certainly possible.
They don't. They don't. Again, sometimes we get in this mindset of we can tell somebody to do something and they're just going to come back 30 days later with some miraculous ability to do that. When, if you look at our own personal behaviors and the goals we set for ourselves, these are journeys. These are longitudinal journeys that require time, they require assistance, they require creating the right set of circumstances to live well, to be well, and again, as we brought up the example of New Year's resolutions. So, another question back to the host. How many days does it take to make a habit, Dr. McDonald?
Hmm. Well, I mean, I feel like I should know the answer to this. I want to say 3 months.
Okay. So, I think what you were trying to say is 21 days.
Sure. Yeah. 3 weeks. Sorry, I meant 3 weeks. Did I say 3 months? It was my mistake.
Well, because every industry is 21 days to financial freedom, 21 days to six-pack abs, 21 days to, becoming a better golfer. So where did that 21 days of habit formation mindset get created? Got created in plastic surgery. You know
Hmm.
what? It takes 21 days for a patient to who's had a facelift to get used to that new face in the mirror, for the brain to get used to it. That has nothing to do with behavior change. That has nothing to do with health behavior change.
Hmm.
So if you challenge me and you say, "Did you take your boards?" Yes. How many how long does it take on average to institute a health behavior change that sticks, not just for the weekend, but that sticks longitudinally? The answer is on average 66 days, so you were very close.
Ooh, all
And
right.
but it can go up to 253 days. So if
Okay.
you allow for that and you embrace that, that is the cycle of behavior change. In some folks it's long, and some folks it's a little shorter, and there's always relapse. Then you can understand why behavior change on a long-term basis is so very challenging, because there are a lot of things that we need to lock into to make things become a habit. And I know you have plenty of podcasts that bring up ways to form healthy habits, and I love those. I love those.
I think that's the piece is helping. How do we partner with our patients and to make those behavioral changes? And again, we can sit there and talk till we're blue in the face, but again, knowledge is power. And how can we give our patients the knowledge and give our patients the power so that then they can then go make those behavior changes and that which we know are evidence-based, which we know are going to actually move the ball down the field when it comes to keeping them healthier or reversing illnesses and diseases.
So remember back to what's on both ends of this. This device that was invented in, Dr. McDonald knows, probably 1693 by a barber, bloodletter, and surgeon. On both ends of this is trust. So if the person on the bell side trusts me and I on the earbud side trust them, if we have that confidence in each other, that alignment, we'll
Mhm.
call it alignment, we can get anything done. If we don't start there, we'll never wind up there, frankly. That's kind of the way it is, right? So a lot of what goes wrong. So if you think about, the last time you had that sick feeling in your stomach because you had a disagreement with a loved one, and we know it can't be Dr. McDonald and his lovely wife, who is like my favorite person on the planet because they're both perfect human beings, but you don't have a cool side of the pillow, right? Because you're tossing and turning about something you're not, it's almost always due to non-alignment.
Hmm.
So when we talk about aligning, it's much so, and we talk about joy in medicine. Alignment and joy in medicine go hand in hand. And what does that mean? When we get frustrated, when we get angry, when we are really kind of fuming that our patients are not following through on the plans that they agreed to, that we told them that was going to get better outcomes and healthier lives, then it goes back, it goes, sideways. However,
Hmm.
um, when you yourself are not taking on the responsibility of creating the solution sets, especially around behavior change, right? But what you're doing is you're asking open-ended questions, you're giving advice, you're assessing confidence and readiness for change, you're assisting people by pulling out their intrinsic motivation versus what, Dr. McDonald? What's the other kind?
The stick and the
Yes,
extrinsic motivation.
extrinsic. And which one lasts longer?
I'm going to go with the intrinsic.
That's exactly right. Intrinsic motivation. So, when the patient themselves, when you're able to pull out with these open-ended questions, the patient's ideas for change, the patient's solutions for change, the patient's reasons for change, instead of you giving all of that to them, then what you do is you, A, unburden yourself. So, if that patient is still continues to struggle, you're not going to be super frustrated, and actually you'll be more successful because they came up with things that would actually work for them, not
Hmm.
put the statin by your toothbrush, and that's everybody's solution to statin adherence, right? um, and you could think about vaping and tell somebody all you want to that they're going to get lung injury from vaping, but then if you say it like, what do your kids think of your vaping, right? Oh God, that's like a gut punch for so many people. And then, they wind up thinking about their reason for why they may want to change.
Hmm.
And it goes on and on in terms of what would help you be successful. Can I share some things that have been successful for other people and how might that work for you? So as opposed to directing, I think the strategy is, and the joy comes from bringing out the ideas from our patients. At the end of the day, those are the visits that wind up in a hug.
Hmm.
And at the end of the day, the other kind of visits are the ones we go home and fume to our spouses about, so and so didn't do this, and I'm so mad, and I keep telling them the right thing to do. But we can break that cycle if we just embrace a little bit of a different approach with those
Yep.
people who are struggling, with those
Yeah.
people who
Well,
are
and you talk about trust and you talk about partnering with your patients and helping patients engage where they feel like they have some autonomy and they have some ability to make a difference as opposed to just being told what to do.
yeah.
And I think again, to kind of bring this back a little bit to the Center for Healthy Living, I think that's what's so valuable is I, as a physician, can say, hey, you know what, we have 15 minutes together. We can talk about X, Y, and Z, but I'm going to then pass you on to this amazing resource where you can learn more. And by building that trust and having that little bit of relationship, even in a short period of time, the physician recommendation to then go move forwards with this other program where they can delve deeper into their own education and their own aspects to make these changes. Like that's, I think, an amazing resource and so incredibly valuable.
That is the power of Permanente medicine. That is the power of the physician. That is the role of the physician. You're not there to be their dietitian, their
Hmm.
social worker, their exercise counselor. No offense to my sports medicine boarded colleague. You are there to provide expertise, and backtracking into the earlier conversation, the patient is there to provide the expertise on what? On themselves. And when you
Yep.
partner, your days fly by and they're so joyous. And the opposite is also true.
Yeah. Yeah. Well, and I think that says so much about the building that relationship between the patient and the physician, that trust, which helps fulfill us as physicians and makes us more sustainable in our own practice and our own professional wellness, but also ultimately helps the patients achieve their goals better and stay healthier also.
And so you might ask, well, that sounds good on a podcast. But does it work in reality, right? And you
Mhm.
said you were going to start with the evidence base and do this awesome human-centered design, and life is going to be like puppy dogs and rainbows if I use some of these like little tips to engage with the patient. And so, if you are the kind of person that is driven by outcomes, are you, Dr. McDonald?
I am highly motivated by outcomes. I will not lie.
Got it. So when we embrace the very techniques you and I are talking about us using here, and we apply them to these constructs, and it's different in every region, but when you apply this construct to a group education type of class, it's no longer a class, it's a workshop,
Right.
right? Workshops in life change. And the power of the technique that I'm kind of dancing around is called motivational interviewing. But I
I've
was
heard
trying
of that
to
before.
say
Heard of
it
that
without
somewhere.
saying it. But what we have done is we have proven, and when I say we, it's not us. We don't study our own data. But when we go to the evidence, we build it with folks, and then we use motivational interviewing. Those three constructs alone, we can drop a patient's A1C by 1%, which is as much as metformin, or more in those patients who are 9, 10, 11 A1Cs in just 2 sessions. We can drop body weight of 5%, which approximates some of the weight loss medications out there, just through a 16-week lifestyle-based program. So we chase outcomes and we chase things that are meaningful. We don't chase information. Why, Dr. McDonald? Where can you get information these days?
Everywhere?
Everywhere. So
Everywhere.
your my practice used to be I Googled this, doc, and now
Yep.
it's I chat GPT'd this. And here's what chat GPT says is wrong with me, and here's what chat GPT says I should do about that. So I need you to prescribe this because that's the information that I got, right? So information is just a commodity. But real expertise in helping people change their behaviors long term, that still is a human function. I know everybody wants to AI everything. And by the way, I loved podcast number 36 with Dr. Kang Nguyen, the AI king. And the future is absolutely there to incorporate AI into a lot of this. And there is still something about that relationship
Yep.
that some of these skills AI is really not close to being able to deliver upon. That again, I think that we are lucky to be on the human side of the robot wars, because there's still some things that we do a hell of a lot better than AI. Not
Yeah.
that I'm against AI.
Nope.
Took
Definitely
my
has its
car to
role.
the dealer, let that AI agent make my appointment, and you know what? It was a lot more helpful than some of the people that work there.
Well, and everything you're talking about here is how do we help activate a patient, right? We
Yeah,
can counsel a patient,
yeah.
but then how do we activate a patient? And those are different things. So tell us again for the physicians listening out there who have been used to that, motivational interviewing and counseling a patient, what is the difference between that versus activating a patient to then go on and use all these other resources?
So again, what I'm going to do is I'm going to boil this down into 5 A's. I think you were an A plus student from what I remember. You know,
Sometimes, maybe.
yeah. Well, even if you're not, your audience is.
Oh, probably.
So we'll give you the 5 A's.
Perfect.
Ask, advise, assess, assist, arrange. And all of these things are along the spirit of getting respecting the patient's autonomy. You made the magic A word, autonomy. So when the patient says, when you ask them, is it okay if we talk about your weight today? If they say yes, then they have embraced the autonomy to give you the permission to go into that space. They're much more receptive to what you have to say. When you ask them, would it be okay if I shared with you some things that we know about make up the condition, diabetes or hypertension and that kind of a thing? Yes, you may. That again is autonomy. It's not any different than the information you were going to give them anyway, is it?
Hmm.
Except you've asked for that space and that permission and therefore respected them. Okay. And then your job is always to not be judgmental, but to assess. So, is this person going to walk out of this office with a greater than 5 to 6 out of 10 chance of activating through what they said were good ideas that they had come up with, or less? And if it's less, be honest and be realistic and say that sometimes behavior change, like our New Year's resolutions, takes time, and don't get frustrated, right? And then, they're always asking for our assistance in terms of, well, they will ask you for expertise, and don't fall into just the information trap always. It's not always the driver of health behavior change.
Hmm.
But we are tasked with delivering information. It's just open that space for autonomy, respect their opinions about things. Don't make anybody feel stupid, belittle. How could you think that the vaccine for flu causes the flu itself? Don't you know we have all these studies? Don't be like that.
Right.
Just respect the fact that that's where they're coming from, right? And then share your expertise. And then lastly, the last A is arrange, right? You really want to set up these smart goals with your patients. You don't want to let them off the hook and say, I'll be better. I'll see you at next year's physical. My triglycerides will be down from 450 because I'll stop drinking and that kind of a thing. What you want to do is you want to set up these smart goals to hold them accountable, both in a time fashion, but also in a medically appropriate expertise glide path.
Yeah. Yeah. No, I think it makes perfect sense. I love how you, I think you and I are obviously cut from the same cloth. We both love the Center for Healthy Living, because it's not just support, it's an actual intervention. I
Yeah.
use this example all the time. I talk about diet, I talk about exercise, I talk about sleep. But how often do I say, I want you to walk 30 minutes, 5 days a week? How often do we
Yeah.
say, here's some metformin, you should take some? But
Yeah.
that's what we do a lot of times in these exam rooms. We tell patients, just using exercise as an example, you should exercise more. And we don't
Yeah.
make it a SMART goal. We're not specific or targeted about what it is. And that's one thing that I try to do is think about these lifestyle interventions as an actual intervention and not just sort of an afterthought or a support tool. So for those out there who maybe are not as familiar with it, how do you think about the Center for Healthy Living as an actual clinical intervention as opposed to just kind of like extra help?
This is great. And by the way, if you're like me and you've screwed this up 10,000 times a day in your career and you're sitting there thinking like, oh my God, all I ever do is tell people what to do. And like,
True.
what am I doing? That's okay. That's been my journey. That's been
Yep.
Dr. McDonald's journey. And
100%.
there's a better place to land. So definitely, that's one of the reasons we got together today to hopefully lift all boats, help people in what you really want to achieve, which is what drives you is seeing your patients thrive. So I think we'll go back to one thing you had mentioned is what the role of the physician is. Did you know that the most important driver of a patient coming into health education or Center for Healthy Living, depending upon what you have, is the physician referring them? Why in the world would that be, right? Wouldn't the patients just give me a diabetes program, give me a weight loss program, give me this, give me that? Wouldn't the patients be saying? But actually, what we find is that the highest rate of attendance, the most activated patients are the ones that had this really respectful, collegial conversation with their physician, and that sticks, and that's worth your time.
Yep.
Okay, so that's number one. Number two, if our assessment and plan doesn't always have a space, I don't care if you're using a bridge like I am to save my life or you're using something else. If your assessment and plan doesn't have a space or a line for how the patient's going to help themselves, how our system is going to help the patient help themselves. And again, this can go back to lifestyle, it can go back to financially, it can go back to housing insecure, all kinds of things. How the patient is going to help themselves in a way to help them be healthier, then we're missing something because
Mhm.
that you said it. Only 10% of what's going to happen with that patient's health is doctoring. The other 90% is going to come from somewhere else. So
Yep.
imagine what does your percent assessment and plan look like? Is it 90% something else and 10% doctoring? Probably not. Mine's not. But even a line or two in there concretizing the formal thinking from you to yourself, and now with open notes, patients reading their own notes, in addition to you doing the prompt in your system of care to getting the patient the right help that they need. This is really what we're talking about. It just belongs on that line with metformin and left knee MRI and all those things.
Yep. Yeah, no, I completely agree. This is great. We could probably go on for years, although we got to keep this somewhat wrapped up. I want to ask you one kind of brief question that you touched on earlier about AI and how you see AI kind of shaping health education. And, does it create new challenges and new opportunities as we kind of enter this post Google world, so to speak?
Uh, so I am giving myself permission that the answer I give you on May 29th, 2026 would be very different than 3 months from now, a year from now, and 3 years from now.
Fair
Okay.
point. Fair point. Well
Right
taken.
now, at this particular moment, no, the agentic or other form of AI has really not delivered that kind of capacity to be able to help the patient so far yet with behavior change. It's great for information. It is
Yeah.
absolutely perfect for information. However, being able to unravel what's underneath the surface, this is what AI is not super good at this point
Mhm. Yep.
in the life cycle of this technology. I think there will be a day where 50% of lifestyle intervention is going to be delivered AI, and 50% is going to be delivered by a human being. Yes, I do. And will that leverage our system, preserve our resources, offer things to people who are really driven in that motivation and in that kind of platform? Yes, but we have to build it correctly, and it has to have physician oversight. It has to have the right expertise because, like you brought up, are there unintended consequences of AI? And unfortunately, we're reading about those every day, that
Yeah.
people start to go in there and get bad things, and the AI just wants to serve them, and so kind of keeps giving them things that they really maybe it's do no harm, right? It's where
Right.
you and I always start every conversation is how can we not harm this patient, and then let's move into the space of how we're going to help them. So yes, the potential for the technology is there. No, it is not a one size fits all solution for everybody, and I apologize to Dr. Kang Nguyen for saying that.
Well, it'll be interesting too, because I think, your point of we need to make sure that we have physicians involved on the ground floor as we continue to build these tools
Yeah.
and not sort of, placate that responsibility or shift that responsibility to someone else and coders and designers, which are great, but we have to make sure it's based patient-centered and it's based on evidence and that it helps serve both the patient and the physician trying to help do that work also. I
And
digress.
and then you said, "Hey, as a physician, I'm motivated when I see your diabetic outcomes. Let's just make that
Absolutely.
up. Your
Sure.
A1C drop of 1% or more." Um, I think we have to hold AI to the same standard
Mhm.
because if it can't deliver on the same health outcomes, I understand that everybody thinks it's cheaper. Actually, some of the studies coming out show that in some things AI is not cheaper, believe it
Mhm.
or not. And if it can't measure up to at least our standard of evidence-based and our standard of delivering value-based, outcome-based care,
Yep.
then I would say that it's inferior technology. And again, that's not, I don't want to make a blanket statement. I'm just saying that we need to hold it to the same accountability we hold our lovable human beings like you and me to as well.
Well, I'd love to see AI do cartwheels in the hallway like I do when my patient's A1C drops by 2 or 3 points, but we digress.
We have your video on YouTube of you doing that. I can't remember if you ran up a flight of stairs and then did the cartwheel or if you just did the cartwheel up the stairs. Do you remember?
I don't remember. It's all right. We'll find the video. So awesome. Great conversation. One last question, my favorite question of the whole podcast. What makes you most proud to be a Permanente physician?
Man, uh, that is, that I think has 13,000 answers. I think a lot of them are very, very similar with all of our colleagues across the country. It's our ability to be the leader in value-based, quality-based care because what we do is we give people birthdays, we give people anniversaries, we give people graduations way more than any other system on the planet does because of the incredible care. I don't care if it's cancer care we're talking about, I don't care if it's diabetes care or cardiac care that we provide. I am so incredibly proud of this being a physician run organization in this day and age, frankly, that is a dinosaur and very hard to find. And we stand on top of that world. The reason our patients do so well is because this place is physician run. Please, everybody out there, never ever forget that when you have a really tough day, we still call the shots. And that is really what our secret sauce is, and why we have an advantage, competitive advantage all over the place. It doesn't matter if it's Center for Healthy Living, Dr. McDonald's, like young athletes in college, the sports teams type of clinic. We run this in a way that always has the patients at the center. And that is why I'm so damn proud to be here. We have this big controversy in some of our regions about retirement age and things like that. Guess what? You will have to drag me kicking and screaming out of this place when I'm 65 if they haven't changed that by then, because I love what I do. I love what Dr. McDonald does. I love what you do. And I can stand behind that for our 13 million patients that we take care of. And we're an amazing group. So thank you for your time and having me on, and for your attention on your drive home, or whatever it is. And you owe yourself that mango mojito for all you do for our patients. You really do. Thank you.
Amazing. So well said. I really appreciate you taking the time and sharing your thoughts and your expertise with us and all the listeners out there.
Great.
And thanks for all of you out there listening. Please make sure you like, subscribe, and stay tuned for all of our multitude of Permanente Docs Chats and Permanente Medicine podcasts.
Live long and prosper, everybody.